And that tends to be a common thread with a lot of injuries, that usually, one muscle group ends up not functioning properly or being lazy or slacking, and then another part ends up picking up the slack. This happens in the shoulder all the time with the rotator cuff. A lot of times, all the muscles aren't really working. The scapular stabilizing muscles, the shoulder blade muscles aren't working properly, or are inactive because of the previous injury, and then the rotator cuff tries to do all it can, but eventually it kind of goes.
Yeah, but the biggest problem with women's health is that you go see your OB or your healthcare provider, and they're not trained in muscles and the way they're supposed to function together. They're trained in saving your life and saving your baby's life, and which is great. We need those things, but they give you a little pamphlet that says go home and do more Kegels. So that's at least in the sports medicine realm, we've got some awareness going on. All right, we need scapula strength, and that's missing in women's health.
Yeah, yeah. I mean, it's a good point, and and it is it can be challenging for people to kind of understand how the healthcare model kind of works. Like, I know with myself, people will oftentimes complain about their doctors when it relates to some sort of orthopedic or joint issue, and it's like, well, it's their role, but their role is to kind of refer, get the diagnostic investigation, perform an assessment, determine if there's something that they can help when it comes to treatment. A lot of times it's medication, or it doesn't need to get referred on to a specialist or someone else. That's kind of what their role ends up being.
Oh, absolutely.
And if there is something serious, you want them to find it and deal with it like right
And I was
away.
there to save my life when I deliver. I mean, these are important things, and great. No one person can know everything, and so that's why we have specialties. But I think the biggest issue with the healthcare system as a whole is there's great people in every profession, and there's also people who are just tired and can't bring enough to the table at that moment in their life, and that does the patient a disservice. And so a doctor will refer out to PT, several times and get patients back that aren't helped. And instead of trying more, you go get second opinions from your doctors. You don't often go get second opinions from your PTs or third or fourth or
Yeah,
fifth.
that's true. And then I don't mean to go on a rant or anything, but
Yeah.
I find it's also just retention of the information from the appointment.
Mhm.
And sometimes this will end up being the issue. And I know with myself, when I take my dog to the vet and my wife sends me to the vet, I take incredibly detailed notes, because when I come home, I need to report everything back to my wife. So that ends up being, I mean, that's something that I end up recommending with appointments with whoever you end up seeing for your
I
health,
I actually
is,
patient.
is to
So I
take
say,
good
you bring your
notes.
smartphone. Can I use it? And then
Mhm.
I will videotape them doing what I'm asking them to doing and talking them through every step, and they take home the video with them.
Oh, that's awesome. That's a great idea.
So, yeah.
That's a great idea. Oh, I like that. I like that. Give me your phone. I'm
Just
going to turn on
understand
your phone, and I'm going to take you through the exercises.
well,
That's
correct
great.
execution is so important. I just find so many patients that maybe they're even doing the right exercises, but they're just not executing them correctly because somebody ran off to write notes or see somebody else, or maybe they just didn't even retain it correctly and they forgot an important cue. So making sure these people are doing what they're supposed to be doing correctly
Uh-huh.
is so important.
Okay. And then, so then what can you do to treat pelvic floor dysfunction?
Oh, I love treating pelvic floor dysfunction. It is so fun because there's just so many factors that go into it, and depending on what that factor is, it can be like a switch. I mean, a woman can just go from leaking and not having a pelvic floor, not barely being able to make it to the bathroom, to all of a sudden their pelvic floor just works perfectly. And that is when I did my doctorate work on the pelvis and the SI joints. And so when you look at how the pelvis works and you look at like maybe the hips not moving properly in the socket, and I'm getting so excited about this and I'm going to try not to get it too technical. But when you look at muscles that shut down in the pelvis and you turn them back on, you find them, then all of a sudden how that's pulling and dynamically affecting that system just makes it work. It's incredible. So basically what I do is I go through from head to feet, and I look at every part of the body that has a role in affecting the pelvic floor. And then we look at in that patient, we look at what's not meeting those expectations. And then we look at fixing them. So is your head forward? Do you have forward head posture? Okay, because forward head posture will often make your bottom round under. So if your bottom tucks under, it's going to really affect your pelvic floor. It's probably going to make you clench your glutes, clench your pelvic floor. Remember we talked about that tight pelvic floor. So looking at posture, looking at how your diaphragm functions. So your diaphragm pushes down when you inhale, if your diaphragm works correctly. So if you have a shallow breathing pattern, so what I like to do is have you put a hand on your chest and a hand on your belly, and then give me a nice big inhale. Did your hand on your chest rise or did your hand on your belly rise? So basically, if you're a shallow breather, that means you're not putting adequate pressure down on the pelvic floor, because it works like, remember that cylinder you talked about? Mm-hmm. So that cylinder has pressure on the top and pressure on the bottom. Mm-hmm. Okay? So when you inhale, your diaphragm comes down, pelvic floor relaxes. Remember those people that are holding too tight? Most of them are in a shallow breathing pattern, and they never put that pressure down from the diaphragm on their pelvic floor. Then when you exhale, pelvic floor responds by springing back up, tightening. So you get this natural system of relaxing and strengthening all day long that makes a great pelvic floor. So looking at your breathing, your hip strength, your glute strength, your posture. So all of this, I put this kind of together in what I call 7 pillars of a great pelvic floor. So it systematically looks at every part of your body, and then you can do like this little self-check. All right, do I have this? Does this look good? Does this work on me? All right, check, move on to the next one. Or no, this is an issue. I need to fix this. So as you go through, you kind of see what parts of the body respond and what's affecting your pelvic floor.
That's cool. I like the 7 pillars of a healthy pelvic floor. That's neat.
The body is so intricately connected. So I think that's where one thing that bugs me about Western medicine is we want to write a script for, oh, just look at the shoulder, oh, just look at the knee. But to me, the body has to function together in such an intricate manner. And so if you have one thing off in one part, that can affect the whole opposite side of the body, and you might not even realize it.
Cool. Yeah, it's true. It's true, definitely. Now, this might kind of relate back to the start or kind of expand on what you just answered, but so what we talked about pelvic floor and what we can do about pelvic floor dysfunction. Now, what can we what can we do with diastasis and core training? What can we do when it comes to those two?
Well, the first thing I would do with diastasis is check your rib cage angle. So, do your ribs sit forward, like you're sticking out your chest too much, or does your rib cage align centered with your pelvis? Okay, so you can usually take a quick selfie sideways in the bathroom mirror and see where your rib is. Did your chest way out or is it down? And even with a lot of postpartum women, because of just so much breastfeeding, they're bringing their chest down to their babies. So their rib cage is flared not forward and back, but it's flared open side to side because they're bringing themselves down. But what's happened is because that baby grew and was so big, they had to make room for it. So their ribs tend to flare, and then they never got back those great obliques and then little interosseous muscle underneath the rib cage to help pull their ribs back down. So when you get the ribs back down, you help the diaphragm function properly. And then that helps. So instead of pulling apart on that diastasis all day long, all of a sudden now your ribs are closed and you're supporting that diastasis. And then stop drawing in your belly button. I know this is a common advice given for diastasis, but I'm seeing people 20 years later and they still have diastasis, and they have a huge habit of drawing in their belly button. So don't draw in your belly button. When you draw in your belly button, it shuts down your diaphragm. Your diaphragm helps your entire core connect. Okay, so stopping that, but then making sure your pelvis is strong. So the bottom of the diastasis, the bottom of your abs, and the top of your abs really come together, and then doing lots of transverse plane work, so that side work, so like side rotations with the band, things like that, to help work from that different angle, making sure you have great lats. I mean, all of these are core muscles, but they're not, sit on the floor and do crunches muscles.
Okay. And then, that kind of brings in my last question. Like, how do we incorporate, these two conditions, diastasis and pelvic floor dysfunction? Like, how do we incorporate that into our regular workout? Like, can we, keep doing what we're regularly doing? Or do we need to, pull it back a little bit for a little while?
Well, it depends on what stage of life you're in. But if you're a postpartum woman, then I truly believe that you should take steps from 2 weeks on to get your body back and get all of these things functioning correctly. And I know that that whole bounce back or get your body back thing is so taboo right now with just let's support women where they're at, but I just really don't want to do that. I want to make them better. so so help get their bodies functioning like it should before they dive back into regular exercise. That is optimal. But if that is not the case, then basically curtail the things that are hurting their progress. So that forward front loading for the diastasis or lots of jumping for the pelvic floor, things that are doing damage and aren't helping your progress.
Awesome. Now, Dr. Sarah Duval, if I said it correctly, where can people get more information from you?
Yeah, absolutely. I have a website, coreexercisesolutions.com. And I'm also on Facebook and I have a lot of videos on YouTube. I've got a free pelvic floor challenge that's about 3 minutes and it's 3 exercises to help tap into your diaphragm, some of the things we talked about today. And a lot of women notice results just from adding these 3 exercises, so that's kind of fun. I have another one for diastasis, so you can find both of those on my website. And then I have this amazing program where women are coming together and we're sharing. I'm extremely present in it. I'm a little obsessive, you can probably tell. So I'm very, very, very hands-on with my wanting these women to get better. So we're sharing and talking, and it basically takes them through those 7 pillars and a workout for their pelvic floor and diastasis. And it's only $25 a month, which is less than a copay for one visit. So
Awesome. Awesome. Now, before we wrap up, I forgot one of my last questions I usually ask, which is, is there anything that I didn't ask you, or is there anything that you want to leave people with?
Don't settle. So there's so many women that I see where they think they have to live that way. And they think that this is now, well, I'm a mom, so this is just my life now, and I'm not going to be able to have my abs back, or I'm always going to leak a little, and that's just how it is, and that's not true, and I just don't want women to have to live with that. Like there's something better. You have to work for it. You have to learn, which is what I love about you. You really do a great job of teaching people, so they have to learn about their bodies, and it's not easy. It's work, but there is work to be had, and there's progress to be made. So basically just want to leave people with that is just don't settle. So
awesome. That's great advice. That's great advice. Awesome. So thank you very much, Dr. Sarah Duval, and thank you everyone at exercisesforinjuries.com. I hope you enjoyed this interview or article or video. Now make sure to swing by exercisesforinjuries.com, enter in your injury or pain. There's a good chance of an article, video, or interview that'll help you overcome your injury or pain. So this is Rick Casalge with Dr. Sarah Duval saying take care and bye-bye.
bye.